housekeeping. There we go. It is being recorded. I will be using, as usual, what I call the speaker's queue, where we will have moments when we will ask for comments and questions. I will then ask for names to be entered into the queue or the waiting list. And I will ask people to use the raise your hand. If you're online, use the raise your hand icon at the bottom of the screen. I'm phasing out having people typing their name in the chat because there's so much that goes on in the chat. I will lose people. So if you're online, please use that. And if you are just on the phone, there will be moments when I will call for people to give me their name, and you would unmute the phone by pressing *6. If you're on the phone, by the way, you can also raise your hand in the webinar by pressing *9. But to mute or unmute yourself, it's *6 on your phone. Or obviously, if you have computer audio, you click mute and unmute on the left, bottom left of your screen. And as far as any other agreements, I would say that on page 2 of the agenda, each and every month, we have the agreements about participant behavior standards that we came up with years ago, which were generated by stakeholders. And so the basic premise of this is that we are all adults here. We are professional in the sense, being paid or not, that we are here for a purpose. And the purpose is to improve things for people receiving the CDASS or IHSS benefits program services, consumer-directed attendant support services, and in-home support services. So with that, if you haven't, please take a time to look that over. It's on the agenda, which you got through email or you got through the US mail, and it is on our webpage. If we can scroll back up, thank you. I will reserve the right, as always, to call timeout in the meeting if there's anything that I feel goes in violation, as it were, of those agreements, doing that on behalf of the meeting. And I will always try to do that as respectfully as I can. Another new tool we've been using is when we do use the speaker's queue, we are going to limit each person to raise your hand once for one question or one comment. We're not going to have people do a series of comments because we want to hear from as many people as we can. Right now we have 53 people, and usually it goes up from there. So those are the agreements. That's how I'm going to operate. I appreciate your understanding that I'm going to be doing that with as much respect as I can. So now I'm going to ask people who are on the phone. And as I always do, let me start with Ron and Tracy Heller. I have your names down for attendance that you are on the phone. So Ron and Tracy, you are good. If there's anyone else who's on the phone, you can unmute your phone and you can give me your name.
Dolores Hurley.
Thank you, Dolores. And Ron, you are down ×2 now. Thank you. I'm smiling when I say it. Renee, thank you. Ron, Tracy, Dolores, Renee, anyone else? I believe that Robin Stevens is with us by phone today. I'm going to mark her down. Anyone else who is only on the phone and wants to have your name recorded for attendance purposes? And for those who are new, reason for attendance is the stakeholders have set up a system in the meeting where stakeholders become eligible for voting on written recommendations and other type decisions through attendance. And that is all detailed again on the agenda, which at your leisure, please look at. It was developed years ago by stakeholders. So I will circle again later in the meeting to ask about phone only. Let me now move us to the open forum. And again, for those who are new or would like a refresher, there are 2 open forums in each meeting. Each one is 10 minutes long. And these are for the purpose of stakeholders making announcements, stakeholders wanting to connect with other stakeholders around things, which you can then take offline. And I can certainly, with permission, always help to connect stakeholders, because obviously I have a lot of contact information for folks, but we do ask that you keep a 2-minute limit to your comments in general and including the open forum. We are not doing back and forth discussion. If you ask a question of the department in open forum, 95% of the time we are going to take that question and circle back with a response at some point, whether it's individually to you, whether it's in another meeting, but we are not doing back and forth questions and answers in the open forum. So with that, let me ask if there's anyone. You can raise your hand in the webinar. I've got mine turned on and off, so you see where it is, the button's on the bottom. Okay, Ashley, I have your name down for the open forum. Anyone else? And while people are raising their hand, I will ask those who are on the phone only to unmute and give me your name if you want to be in this open forum number 1. Anyone? Okay, Danny, have you down? And as always, we will start with non-department people. And we usually start, if there are any consumers, et cetera, advocates, families. So we will go in order today of how we got them. Ashley Young of PPL, please go ahead. 2 minutes.
Hi, this is Ashley Young with Public Partnerships. I just wanted to let everybody know that I'm getting ready to head out on maternity leave for a couple months, and I wanted to give you some updated contacts for PPL while I'm out on maternity leave. We got a couple people who'd like to introduce themselves from PPL, the new manager for the Colorado account and our other account specialist. So if Alex, if you wanted to introduce yourself.
Yes, hi. Thank you, Ashley. Hello, everybody. My name is Alejandro Contreras. I also go by Alex, which I know is probably easier to pronounce. I'm the new senior account manager for PPL, dealing with the Colorado program. And so I'm very excited to be a part of this and to work with everybody here. So I've been with PPL for about 2 years. Prior to me being an account manager, I was working as a senior project manager in our project management office. So yeah, just excited to be here. Please let me know if you have any questions. And I will turn it over to Tracy.
Okay, not hearing Tracy. This is John Barry again. We will move forward in the interest of time, and Tracy can always speak.
I'm back.
If webinar, so that we can keep moving. Is that you, Tracy?
Yeah, I'm fixed.
Okay, you got about 30 seconds. Thank you, ma'am.
All right. My name's Tracy Whitehead. I am the new client service associate for Colorado. I will be assisting Alex on the Colorado account. Though I am new to this position, I've been with PPL for 9 years, and for 8 out of those 9 years, I worked on the Colorado account. So I'm very excited about helping Alex and taking on this new role.
Thank you very much. And I was going to say this anyway, but I think it might have been mentioned in the chat. If you can place your contact information in the chat, and we will make sure that we get that read out for people who are just on the phone, if that includes a phone number. So thank you all. Danny Comstock, you were up next, I believe.
Thanks, John. Hi, everyone. I'm Danny Comstock. I know most of you, CDASS policy advisor here at the department, but I just wanted to let everybody know, as you know, we've been doing the case management redesign rule revisions, and we held a meeting a few weeks ago regarding changes to the health maintenance activities, task definitions, and through the meeting and after, we received some additional feedback. So our team will be holding another stakeholder engagement meeting for anyone interested in providing input to health maintenance activities regulation. So our next meeting is going to be on August 1st at 2:00 p.m. until 2:45 p.m. I know this is short notice. We have a pretty quick turnaround deadline for getting these rules revised. So if you are interested, please email the PDP inbox or give us a call at 303-866-5638. Again, the phone number for our team is 303-866-5638, and I will put all of this information in the chat as well.
Unmute myself. Thanks, Danny. Okay, we do have a couple minutes on this 10-minute open forum number 1. Is there any other stakeholder who would like to enter their name into the queue for this? Announcements, questions? We do have a topic request form, so we really don't get many or take many topic requests through the open forum, although certainly we can for people who are on the phone only, for example. But okay, hearing none. Folks, we do have another open forum at the end of the meeting. So I will move us forward. And Community First Choice, otherwise known as CFC update. And CFC team, are you with us?
I am. Hi, everyone. This is Christine Dos Santos with the department. I am the Participant Directed Programs Community First Choice Policy Advisor. I'm here to give you guys just a quick update. I actually don't have too much to talk about or to update everyone on. The CFC team has been working really hard on trying to finalize our wellness education benefit rule. And that's been taking up a good portion of our time as of late. Also want to give a plug for our next meeting. Our next council meeting is going to be next Wednesday at 10 a.m. and that goes until 11:30. We will be discussing updates on transition services as well as some follow-up surrounding provider qualifications discussions we'd had several months ago at this point. I'm more than happy though to take any questions if you have any, and hopefully we will see you all at our council meeting.
Thank you, Christine. Again, this is John Barry. So if anyone has a comment or question for Christine regarding Community First Choice, please raise your hand in the webinar. And if you're on the phone only, you can unmute your phone by pressing *6 and giving me your name right now. So it's CFC, Community First Choice. Any questions? Seeing none. Okay, hearing none. Thanks, Christine. Okay, now the next item we have marked down Julie Riskin, and I am looking on my list to see if she's in the meeting. Last I looked, she wasn't. Julie, are you with us? Okay, and I am unclear, staff, whether there was anyone else who, maybe you're not the ones to ask, but in lieu of Julie speaking, is there someone else who's been involved with this who would speak about this issue? It sounds like there's something somewhere in the process of a formal recommendation regarding sick pay.
Yeah, John, this is Danny. I'm not sure entirely where the process is. I think this was sitting with Julie, and I think Robin Bulldog might have been working on it too. I don't think either of them are in attendance today. And I think we're also all out of co-chairs today. So if we have none of them here, and if nobody else in this group is wanting to speak on the formal recommendation for sick pay, we can maybe move this to next month's meeting agenda.
Sounds good. I would just say out loud, just so that folks in the meeting are clear that, and this is a question, Danny, that we have not received a formal recommendation on this. Yeah, that is
Not yet.
correct. Right. Okay. So folks, that's where that is at. And obviously this is all volunteer work, people doing the best they can. We all know how busy Julie is. So we'll circle with her about getting this on the agenda again next month. We are early for our next item, which is Dr. Kristen Ritter. And Kristen, I am assuming you can hear me, and I am going to frame this up. We're a little bit early. I hope that's okay. And Dr. Ritter has contacted the department to be able to communicate with the meeting about something she would like to, about a rule change that she is interested in happening. And back to our previous topic, that this sort of thing would generally end up at some point as a written recommendation if the group wants to go forward with that kind of a thing. But here we have an individual stakeholder who, by the way, is new to the meeting, and I really welcome Kristen. And we are going to put the written form of the presentation that she had given us on the screen. There it is. And Kristen is going to utilize the technology to speak. And I'm real excited that we are able to do this. So Kristen, if you are there, and I see you, do I see you in the attendance list? Okay, I don't see Kristen right now.
Well, we're here.
Oh, I beg your pardon. Very good. Okay. So you can take it right away, Kristen.
Colorado DASS 129% rule. My name is Kristen Ritter. I want to thank you for having me today. I will speak about why I believe that DASS participants should be allowed to spend more than 129.99% of their monthly allocation when they have enough unspent funding to cover their occasional extra staffing costs. You probably have already recognized that I talk with a computerized, generated voice. Therefore, I mispronounce some words. Please excuse my mispronunciations. I realize that there are good reasons for the 129.99% cap on monthly spending. Not everyone is good at budgeting money in general. This cap on spending gives these people the opportunity to receive more training on budgeting. Hopefully, such guidance helps them stay within their allocation and to continue to receive DASS funding. I want this opportunity for those people who really need to gain more budgeting skills. However, going over the 129.99% limit doesn't always mean that everyone needs any kind of intervention. This is especially true when people have more than enough unspent funding to cover their extra staffing expenditures for a month or two. I have been in this camp, and here is my story. During the pandemic, I had to leave my home in Greeley and move closer to my family. I planned for months in advance to return to Greeley. I knew that reestablishing myself in Greeley would require countless hours of double staffing to train my new staff, so I saved my DASS funding in any way I could. For example, I spent many weekends with my parents, so I wouldn't have to pay support staff for 2 days out of the week. Also, I got a roommate to do most of my overnight care, enabling me to save even more of my DASS funding for my return home. Like most people, I often became annoyed with my roommate. Trust me, I didn't like making these sacrifices regarding my autonomy and personal space, but I knew returning to Greeley would require more DASS funding than my monthly allocation. And I didn't want to go over my allocation and possibly go into a skilled nursing facility. So I powered through, allowing me to have enough unspent funding to do what it would take to return home. Anyway, I managed to save approximately $5,000 of unspent funding. I assumed that this was enough to cover any extra staffing expenditures that might come up with packing, taking the road trip to Greeley, and then training my new staff. A month before my move, I increased my staff to make those last-minute doctor's appointments, run extra errands, interview, and hire Greeley staff long distance, pack all of my necessary things for my road trip, and make the trip back home. At every turn, I spent my personal money on things for the move as well as care packages for my elderly parents. See, my mom was newly diagnosed with cancer that filled her abdomen. And my dad, who needed 2 knee replacements, had to take care of her as well as their house. So I bought my mom more comfortable clothes, so my dad wouldn't need to do the laundry every other day. I also bought different snacks to encourage my mom to eat. Because of her cancer diagnosis, I considered delaying my move. But everything already was set in motion. For example, my landlord found someone to take over my lease. Besides, I needed to get back to Greeley to oversee a rebuild of my house that suffered significant water damage due to a flood. I finally returned to Greeley on March 27. A few days later, I started to approve my support staff's timesheets like I had done 100 times before. But this time, a couple of these timesheets bounced back saying insufficient funds. What? What went wrong? Did I misread the amount of my unspent funding? When I double-checked my unspent funding on my FMS's portal, I saw the amount that I thought I had, now approximately $4,500. With further investigation, I found out the rule that prohibited anyone from spending more than 129.99% of their monthly allocation, even if they had plenty of unspent funding to cover all of the extra staffing expenditures. What was worse yet was there was absolutely no exception to this rule. This means that I had 2 support staff who were only partially paid through my FMS provider. It so happened that these 2 staff moved temporarily to work with me until I hired enough staff for me to survive without them. Knowing they could quit if they weren't paid in full, I had no choice but to pay them myself. All of those sacrifices that I made to save funding were for nothing. I still remember hanging my head in defeat. After getting over my despair, I became beyond furious. The 129.99% cap not only made me pay my staff, but it ruined my plans to use a lot of my unspent funding on double staffing required for training my new staff. I calculated that I would never be able to use all of my unspent funding before my annual renewal, when I would lose all of my funding that I so carefully saved up. From my own perspective, the cap is unjust. You may think I just had a string of bad luck, causing more personal expenses regarding my mom. And these expenses caused me personal hardship paying my staff. But I was just experiencing life. Sometimes life piles unexpected events on everyone. For instance, almost everyone has been touched by cancer. Unfortunately, people with severe disabilities have many more moving parts to plan for. For instance, some of my new support staff suddenly quit because this job is not for everyone. When a staff leaves without any notice, I have to cover the holes in the schedule somehow, as my physical disability is too severe for me to be left alone. Filling the open shifts often requires me to pay overtime. I believe that a number of able-bodied employers experience a similar problem with retaining staff, especially nowadays. However, many people like me do not have the luxury of not having help for a day or two. If we did this, we would not get out of bed, eat, relieve ourselves, and take our medications. Therefore, we have no choice but to dip into our unspent funding to pay for overtime and then double staffing for training our new support staff. This is a necessary evil. So let people like me utilize all of their unspent funding without being penalized for what they have to do to just survive. When someone goes over the 129.99% cap, perhaps their caseworker can check in on them and see if everything is okay but don't make them go through unnecessary training for getting their needs met during rough times. Please change the rules regarding the cap so that people like me can use all of our unspent funding to meet our physical needs. Thank you once again for letting me raise an issue at your monthly meetings.
Okay, this is John Barry. First of all, Kristen, thank you so much for putting this together, for having it in written form, for utilizing your software so that it can be read out loud. And I did go over this with Kristen earlier today, just in terms of how this portion of our meeting was going to work and try to figure out the technology and all that. So during that time, I did describe to her, which I want to make sure that everyone is reminded of or learns for the first time, that when someone wants to achieve some sort of change in policy, rule, whatever, benefits, services, coverage, anything like that, one of the main purposes of this group is for written recommendations to be sent to the department. So you can think of this as the first event in whatever series of events may occur that might lead to a written recommendation to the department. This issue sounds awfully familiar to me. I think this kind of issue has been talked about at points over the years. So Kristen, I believe you're not alone in having expressed this sentiment to the department. And I must apologize, I don't really recall the history of any written recommendations that were attempted or put forward around this, but I would say that I did clarify, so this is to the whole group, I did clarify with Kristen that she would like this to go to a written recommendation, and she will need to not do that alone. And what I said to her today was that often there are time-limited work groups, subcommittees, whatever you want to call them, that come together to draft a written recommendation. I don't know whether there's interest in the group for that to happen or not. That's up to stakeholders. But for the moment, let me ask if anyone has a response that they would like to say out loud to Kristen. This is being recorded, so Kristen can certainly listen to the recording, as you all can later on. And if anyone does, you can certainly raise your hand right now in the webinar. We have about 7 minutes left in this point. I see one hand raised. While others are thinking about that, let me ask if anyone who's on the phone only would like to be entered into the speakers queue. You can do that by pressing *9 on your phone or pressing *6 to unmute and giving me your name. Okay, I will go with the hands that are raised, and let me start with Jerry Froney, and time is a little bit of an issue at this point, but I remind people about your 2-minute limit. Jerry Froney, please go ahead.
Yes, I just wanted to support what Kristen is asking for and ask the group how we can best move forward with this. I'm not actually that familiar with the actual rules involved here. So John or another stakeholder, tell me what we can do today to move this forward in a most expeditious way. Thank you.
Thank you, Jerry. Let me do this. Let me suggest we go to the next hand raise, and then I can certainly respond to the extent I can to what you said. Kelly Tobin, you're up next. Thank you. You have 2 minutes.
Hi there. I wrote a comment, but I'm not sure, who sees them and who doesn't, or if you're, Kristen, able to access them or not. I just said, thank you very much. Important points. I've been there and I learned the rule in a similar way, despite being on the program for years and understanding how it otherwise works. I also had to pay out of pocket when I had a whole lot of surplus budget. So thank you. That's all.
Okay, Kelly, thank you very much. Anyone else who has a an immediate response for Kristen. Okay. Chanda Hinton, welcome back to the meeting. Go ahead. You have 2 minutes, please.
Hey, thank you, John. I was just gonna say that I would like the group to maybe consider, let's bring the formal rule that's specific to this particular thing. And then I think that even if this group were to offside, and I'm happy to support, but even if it's like, here's the rule and here's what recommendations to the rule, language change that we'd like to formally recommend. I think what John had said earlier is doing it through this committee is really a great idea. And I know that sometimes we can't actually do work through the committee meeting, but I do think that the committee should be looking at the rules and maybe looking at the recommendations to then formally like give support to it.
Thank you, Chanda. And folks, by the way, you just heard from someone who was few years ago a stakeholder co-chair of this group. So good to hear you again. Anyone else who has a quick comment? Okay. So I am making this up as I go along here today, folks, but I think certainly I'm really glad Kristen showed up and has put this forward. You may remember we mentioned that the two stakeholder co-chairs, Kurt and Kevin, are not here today with us. So what I'm going to do is take it and commit myself to talk to them about seeing if they can help, facilitate this process. If it's a matter of finding out who else in the group is interested in being part of a work team, a time-limited work group, whatever you want to call it, that they will take that on. And so I am going to mention to them that Jerry and Kelly and Chanda did respond with comments. So they might be reaching out to you to see what your thoughts are at this point, and as well, Kristen, obviously. So that's how I think we can reasonably leave things for the moment. This is a stakeholder process. I'm here to help by explaining how these things generally go. So with that, I will bring this item to an end. And thank you again, Kristen. The next item up is item number 7, overspending protocol. No, I beg your pardon. Item number 8, request for proposal RFP update by Jessica.
Thanks, John. Hi, everyone. Jessica here, Participant Directed Programs Contract Specialist. So I'll give a quick recap of the RFPs for anyone who is new or just unfamiliar with what that is and the process. So we're coming off of the end of a 5-year cycle for our FMS and training and operations contracts. These contracts need to be rebid every 5 years through the request for proposal RFP process. And that's just really soliciting bids from interested companies to do the work. As of now, we've been working on the RFPs for quite some time. And so as of now, we are on track with our timeline and the process. I anticipate these documents will be posted mid-August to the state solicitation website and be promoted out through a variety of different channels. At that time, they'll be open for bid from interested companies and available for view by the public. The time that they'll be open is between 30 to 45 days. And during that period, the department will respond to any questions that come in about what's contained in those documents. The feedback that our unit has received over the last several years and gathered specifically from the RFP listening sessions that we held and a survey that we completed was really closely reviewed. I can't provide any specific details on the changes that were incorporated into the RFP and the draft contracts or additional requirements that were created because they're not posted yet. But I can share that the major themes that were coming out of that feedback, things like more supportive technologies, more responsive customer service, clearer and more accessible information have been addressed. We're really looking forward to this upcoming period to see the interest in our contracts and getting a lot of bids. That's ultimately the goal. And we will have new contracts begin July 1st of 2024, the start of fiscal year 2024-25. If we have any new contractors coming in, and the goal we've mentioned in the past is to have 3 FMS, then and any current contractors exiting, there will be a transition time starting April 1st, 2024 through the end of June. Thanks. That's all I've got.
Thank you very much, Jessica. The process caught me typing off screen because we are pretty far ahead of schedule and I'm trying to figure that out. In the meantime, we do have someone who's raised their hand in the webinar. Tony, please go ahead. You have 2 minutes. Thank you.
Hi, good afternoon. Thank you, Jessica, for that update. My name is Tony Venzor. I'm with Centennial SD. We are a new provider hoping to respond to the RFP once it is released. And I just wanted to double check if a readiness review is going to be required by the companies responding to the RFP.
Yeah, thanks for that question, Tony. I'll have to get back to you on that. And I know you've emailed me directly, so I'll respond to your email. I need to check in with our procurement office on that.
Okay, perfect. Thank you so much.
Great. Thanks, Tony. Anyone else? Any other questions for Jessica? Comments? Okay. Anything else, Jessica, or?
I think I see Kelly's hand. Kelly, do you have a question?
Oh, absolutely. Kelly?
Yeah, hi, thanks. I'm just wondering to which email address we should send ideas for the new contracts, or if it's too late at this point.
So we gather that kind of feedback at all times. You can send it to our unit email address, which is HCPF_PDP@state.co.us. If you wanted to participate specifically in the feedback and question period related to the RFPs, let me follow up with you, Kelly, to see if our procurement office has a very specific email address that's going to be channeled through. I believe the website that they'll be posted to collects that directly, but I'm not entirely sure, so I'll have to let you know. And I can share this with the group through John when I have that information.
Thank you. I think you have in the past, and I've just lost track of it. Appreciate it.
No worries, thanks.
Okay, thank you. Chanda Hinton, you're up next. You have 2 minutes, thanks.
Yeah, I think that Jessica might have already responded to it, but I do think that the RFP and sending it over to you, John, in order for all of us to be able to review, and then as a committee, definitely having it in a future agenda to be able to provide feedback on the RFP, I think is pretty important. And I don't know if you guys have already done some of that work in the sense of like even in input prior to the RFP going out rather than latter. And I just wanted to make sure, because I know a lot of other stakeholders in community that haven't been on these meetings have been definitely waiting for some of those details.
Yeah, so I can respond to that, Shanda. Thank you for your comment. I'm also noticing my camera's going in and out, so apologies if that's distracting for anyone. So we did hold a number of different opportunities for people to provide their feedback about the future of these contracts and what they would hope to see, really just what is important to them in CDASS. And so we collected that information already. And as I mentioned earlier, it was reviewed thoroughly and really thoughtfully assessed for how it can inform the new contracts in the RFP. As it relates to your suggestion of like reviewing the RFP in this space, and if I'm misunderstanding you, then please feel free to correct me. But if that is the suggestion, then I do not believe that that is possible. Our RFP process is very strict, and we follow the lead of our procurement and contracts division to use the methods to promote it out to the state, collect feedback, bids, obviously, and then assess those through the formal channels, which includes a committee, a review committee. So we're in the process of getting more information from the division about the committee and forming it. So if and when I'm able to provide that information to you all, I definitely will do that. But as I said earlier, it's a document, and there will be two separate ones, one for the FMSs, one for the training and operations contract. It's open to the public. You can read it. I'm pretty sure you can download it and take notes in ways that are helpful to you. And then if you have anything you'd like to share with the unit about what you're reading, you can definitely do that through our unit inbox email address.
Thank you.
Cool, thanks, Shanda.
Thanks, Chanda. Anyone else who has a question, comment about this topic? The request for proposal? Okay. Hearing none, thank you all. I am noting that we are pretty far ahead of schedule with our meeting, and I'm just going to explain what's going on. I'm trying to think through this issue, which is that we have the breakout rooms that have now become a regular feature of the meeting. People really like them generally. They obviously serve a useful purpose, otherwise we would have heard we can stop doing it. We don't want to fool around with the time frame of those breakout groups too much, because some people come into the meeting specifically around that time for the breakout groups. And we do have an item later on, which is the Colorado Department of Labor and Employment. We have some people who are not regulars in the meeting coming in, I believe a couple of people, and they have set it in their schedule to do that. So we can't really fool around with that too much. So let me see if there are any, I don't see any items on the subcommittee workout group that we can cover right now.
Hey,
But
John, this is Danny. I can
yes.
do the URUM quarterly update now.
Okay,
I just realized that was on the agenda still. Sorry, could have spoke up sooner.
no problem. Thank you.
Okay. Emily's just getting visual aid up for everyone. All right. So as promised, I'm doing our quarterly report out for the utilization review, utilization management stats, essentially, that are based on the reviews conducted by Telegen. This was a commitment that our team made to keep stakeholders updated and informed of progress and just information about Telegen utilization management reviews. So we could go to the next slide, please. Alrighty, so just a quarter in review. The reviews that are included in this count of 2,994 reviews that were completed between the months of April and the end of June are all of our CDASS reviews that have health maintenance activities. So that would be our CDASS HMA or health maintenance activity reviews, CDASS rapid reviews, our overlapping scope with over cost containment CDASS reviews, and then our express reviews. Additionally, we're including all of the IHSS reviews that were conducted by Telegen. And again, these reviews are only conducted if the member has health maintenance activities. So yeah, in total, we have close to 3,000 reviews completed over the course of 3 months. I also would just like to point out that the number of reviews does not necessarily correlate to the number of members that were reviewed. Sometimes members can have multiple reviews or duplicate reviews are submitted. And so the number of members who received a review is smaller. And I apologize, I didn't get that number pulled up before this meeting. The table here below just indicates the number of CDASS specific reviews and the number of IHSS specific reviews, which is pretty consistent with when we think about the population of users who use CDASS versus IHSS. We know IHSS is a lot more heavily utilized. Alrighty, we can go on to the next slide, please. Okay, so just a reminder for everyone or information for anyone that is new to the UR/UM reviews. This slide represents the different outcomes that will be shown on a intelligent outcome letter. The outcome letter does go straight to the case management agency, so it's possible that if you're a member receiving services, you might not have seen the outcome letter, but you're probably hearing the terminology. And so I'd like to just break down what the terminology means a little bit, because I think sometimes it can sound maybe more concerning. And so I'd like to just break that down. So an approval essentially means that all services were requested in the intelligence submission, and all of the services were adequately justified and the case is approved and no alterations whatsoever were made to the service plan. So when we see approval, we know this is just an outright approval. Everything that was requested ended up getting approved and things good. Sometimes we see the term partial denial. And what this means is that some adjustments were required to the case. So maybe the case manager submitted the case, Intelligent completed the review and said, hey, you know, it looks like maybe this service actually belongs in this category instead. And it could even mean not necessarily that the services were denied. It could mean the case manager submitted the case using incorrect procedure codes or didn't fill it out entirely accurate. Intelligent would indicate that as a partial denial for tracking purposes, even though it doesn't necessarily mean the services themselves were denied. So partial denial really just means that some adjustments to the case review itself were required. Sometimes that does mean a decrease in some of the requested hours. Sometimes it means services that were requested under health maintenance activities are actually more appropriate under personal care. But that's what you can expect when you hear the term partial denial. And then we'll get into the technical denial. Technical denial, again, sounds scary. And these occur if Intelligent requests additional information from the case manager and then nothing happens. So I kind of view that as like an abandoned case almost. So their initial review could be completed. Intelligent asks for additional information. And then if there's no response provided by the case manager, 10 business days, so that's 2 weeks, a technical denial is issued. That being said, if a technical denial is issued, case manager is able to reopen the case and submit additional documentation at a later date. So if a case receives a technical denial outcome, that doesn't necessarily mean that that's where it ends, but at the end of the reporting period, that might be where it ends. So for example, if a case is submitted the middle of May and Intelligent requests additional information and the case manager doesn't provide that additional information by the end of May and the case ends up going into technical denial, what that means is on the report that we look at our data from, that case technically has a technical denial, but it's very possible and usually pretty likely that the case manager would reopen that. So what we often see is the case manager will reopen the case in June, but in the May reporting, it's still considered a technical denial, even though maybe in June they submitted the additional information and everything ended up getting approved. And then finally, we'll just define denial. That's the last outcome type that you could see. And a denial is when the entire case is denied. These denials are very rare and usually only occur if the case was submitted incorrectly, and if there's nothing for Telligent to review. So most oftentimes, the most common reasons for an outright denial are if the incorrect view type was submitted. For example, if the case manager is requesting IHSS services and then they submitted a CDASS review to Telligent, that would just get denied. And then what happens is the case manager just resubmits as an IHSS case and the review proceeds accordingly. We also often see requests being submitted multiple times. So there's sometimes where a case manager will submit a request and could be system glitch, could be any number of reasons, but sometimes those requests for the same services get submitted multiple times. When that happens, one of those reviews will get denied and the other one will be reviewed. Those reviews that get denied do get counted in our denial outcome for reporting purposes. And then finally, Telligent does get reviews sometimes where there's not even anything for them to review. So sometimes we have case managers who are really on top of it, wanting to make sure that everything is being covered, and they'll submit a review to Telligent just for Telligent to realize, hey, there's no health maintenance activities to even review here. Those cases also get denied. Again, this does not mean that the services are getting denied. It just means they don't have anything to review. Do we have any questions about the outcome types before we move on? And I'm kind of taking my time here too, because I know that we're a little ahead. So
Thanks, Danny. So folks, this is John. If you do have a question or comment, you can raise your hand in the webinar right now. If you're on the phone only, you can press *9 to raise your hand or *6 to unmute and give me your name. Anybody?
and we will be moving into the specific statistics here right after this slide. So, have more to present, but figured I'd pause.
Okay, Danny, seeing none, hearing none.
All righty. So moving on to the next slide here. These are our combined outcomes of reviews. So on our first slide, when I showed the total number of reviews that I differentiated between CDASS and IHSS, just for the purpose of this meeting, I combined the outcomes of CDASS and IHSS so that we could just look at the total case numbers. So for this month, outright approvals or the approvals without any requested changes remain above 70% for each month during this quarter. So that means of the 3,000 almost reviews that were submitted, over 70%, in fact, closer to 80% for most months, received an outright approval without any modifications. As cases were submitted without errors. Everything was just done correctly and thoroughly, and there were no concerns. Cumulatively, 14.96% of cases required adjustments after the initial submission. So of the 3,000 cases, there were about close to 15% where there was an adjustment that needed to be made. So yeah, and those reasons, like I said, could be as simple as case manager submitted and maybe inputted the incorrect number of units than what they actually meant, which sometimes happens. We have differences in how units get calculated. So some of those things are pretty easy to happen. Or it could mean that maybe not all of the health maintenance activities that were requested were approved. But again, the only 15% required any adjustment. Next up, we have the requests that were abandoned or not responded, where the requests for information were not responded to. And about 5% of cases total for the past quarter were not responded to after a request for information. So of the 3,000 cases, 4.38% or close to 5% did not get the additional information provided, and therefore it resulted in the technical denial. And then finally, we have our outright denials, and for the entire quarter, We have 5.11% of cases that were denied. I would like to point out, of that 5%, 14% were denied for insufficient skilled justification. So the remaining 86% of denials were due to administrative errors, or there not being a case or HMA services to review, the case being submitted incorrectly, any of those reasons where it was simply an administrative denial. That consisted of 86% of our outright denials. You can see the number breakdown here on the denied line. So 6 cases for the month of April were denied for missing clinical justification, 9 in May and 7 in June. I also really want to make sure that everyone is able to consider that these reviews are only for health maintenance activities. So when a denial occurs or a partial denial occurs, it doesn't mean that a member is denied for each CDASS services. It doesn't mean that a member loses access to all of their services. What it means is that sometimes there isn't enough justification to make a task skilled, but the member is also more than welcome to receive those services in personal care. Many of you who receive services know there's a lot of tasks that overlap between personal care and health maintenance activities. So just because something doesn't get across the threshold with the Intelligent review does not mean that the services are completely inaccessible. It just means they may be better or more appropriately received through personal care services. Making sure I don't have anything else about this one. Do we have any questions about the stats right now?
Folks, this is John. If you do have a question, you can raise your hand in the webinar, or if you're on the phone, unmute your phone, *6. Anyone? Okay. None so far. Oh, wait a minute. Okay, Dora Lopez, thank you. You have 2 minutes. Go ahead, please.
Yes, thank you. I just had a quick question. If all the paperwork has not been approved, I guess, do we know how, or are you guys able to tell us how long those changes or corrections typically take to be approved? Like once the case manager already knows what they need to do?
So I think what you're saying is, how long does Intelligent have to review a case once it's submitted to them? Is that what you're asking?
Yes.
So once the case manager has all the information they need for the assessment and they submit the review to Intelligent, Intelligent has 5 business days to complete the review, unless, I will say this, unless there is the possibility that services will be impacted due to time constraints. So if a member's certification period is rapidly approaching and services need to start within, I think our cutoff is 12 days, then Intelligent has 2 business days to review a review once it's submitted to them. So if the case manager submits everything to Intelligent, there's ample justification, everything is thoroughly documented, everything is submitted correctly, the review and an approval can be issued within 5 business days.
Got it. Thank you.
Any other questions? Adam Markert, thanks. You have 2 minutes.
Hi, Danny. Real quick then, when Intelligent's doing overcost containment versus HMA, that's a very specific thing that, like, if the case manager's reason for sending it to Intelligent is one, but then Intelligent has it under another, does that conflict of saying what the reason is for Intelligent's doing it hold up process? And certain, like, who has to fix that? And I only heard about it very recently.
So I think
that somebody had it in a system as, oh, it was said CDASS for something, it was actually for one instead of the other, and
yeah,
somebody's
so
trying
the
to
case, yeah, so when that happens, Intelligent denies those. So those are actually what's included in this denial row here. So when a case is submitted with the incorrect reason for review, those do just get outright denied because they, like if case manager submits a CDASS review and the services are for IHSS, Intelligent doesn't have any IHSS to review, so it just gets denied, and they give the case managers instructions for how to resubmit under the correct review type. But it would be the case manager's responsibility to resubmit that, and they should be receiving notifications at each point in the process for whatever outcome is rendered.
Thank you very much.
Yeah.
Do we have, I'm sorry, go ahead, Danny.
Oh, no, I was just going to say we can move on to the next slide. Alrighty. So I would just like to close this out by letting y'all know of some of the initiatives that are going on in URUM right now. So our team is currently working on finalizing some updates to the health maintenance activities documentation guide, in which we received a lot of feedback from case managers, specifically as they're the ones using the guide as a resource, about ways to improve that. So we are anticipating having that completed by the end of this summer. Additionally, we received a lot of feedback that it'd be helpful to have a guide about how to document for protective oversight and accompaniment, as oftentimes those are some more difficult tasks to understand for case managers and members probably. So that guide will also be completed in summer of 2023. And finally, we've realized an oversight that we've had where we have a lot of resources for case managers, our resources for Diligent, but we don't have a lot of resources specifically for members, targeted towards members, with information that's helpful to members. And so our team is working on developing a resource guide that is hopefully just a couple pages, a quick snapshot of what utilization management reviews are, what members can expect, where they can get more information, and how to navigate that process as self-directed participants. We're hoping to have that guide completed in the fall of 2023. And another purpose for this guide is to also myth bust some of the concerns. I recently learned that there's been some misinformation, perhaps, that if somebody is denied with Telegen, then all of a sudden all of their Medicaid goes away, and that's not even possible. Telegen doesn't have access to the eligibility system to make those determinations, and so I think it's important to clarify that information and make sure that accurate and appropriate information is available for members. So that is something we will be working on developing this fall. And I think that if there's interest, we can bring that to this group too, and make sure that we're really answering some of the questions that you members specifically might have about utilization. Other than that, our next URUM report out will be during October's PDPPC, and you can go to the next slide, M. So if there's any questions, or if you'd like to share if this information was helpful, or if there's something that you'd like to learn more about, please feel free to let me know now. Otherwise, contact me directly and share your feedback that way. You can do that by contacting the Healthcare Policy and Financing inbox, which is listed on the screen. I'll also put it in the chat, or you can call us at 303-866-5638. If there are no questions, that's all I have for you.
Okay, thank you, Danny, and thanks everyone. So we are doing some shuffling and rearranging here to make best use of our time while everyone's here. We are going to move into the CDLE, Colorado Department of Labor Employment item next, and see if we might push the break back a few minutes. So Emily Harvey, can you take it away?
Thanks, John. So we have with us two folks from CDLE, which is the Colorado Department of Labor and Employment. We have Adam Siramarco and we have Zachary Herman with us here today. So Adam represents the FAMLI or family, which is the Family Medical Leave Insurance Program. And we also have Zach here with the Unemployment Insurance Division. And so we are, if you guys want to join us here and introduce yourself, and then we can kind of dive into the questions. So we did provide some questions to the Colorado Department of Labor and Employment. I think it was maybe a couple weeks ago, and provided them with those questions ahead of time so they had time to prepare. So we do ask that we don't go into any member specific questions or any personal questions that as we go through the questions that we had already provided to them. And then we can see and kind of reevaluate after we get through those questions what kind of time we have after that. And so I did get a request here, just 1 second. And we will get that going here. So Adam, do you want to introduce yourself?
Yeah, so hi everyone, my name is Adam Siramarco. I'm a senior policy advisor for the Family Division, which is the division that recently got created for paid family and medical leave for employees here in Colorado. I've been with the division a short couple of months, but have a fairly good grasp on the policies and procedures for family benefits, and can answer any of your questions about how that might apply to your particular organizations.
Great, thank you. And Zachary, would you like to introduce yourself?
Hello, everyone. My name is Zach Herman, and I am the Unemployment Insurance Policy Manager.
Great, thank you, Zach. So we have our first question, and I believe this would be for Adam. How does family apply to CDASS?
Sure. So with CDASS, my understanding is that the client or their authorized representative is considered, legally speaking, the employer. The Family Act provides for partially paid family and medical leave for individuals who require, for employees who require such leave. An employer is defined broadly, and so most individuals who are employers for the purpose of hiring individuals to provide care for them would meet this definition if they paid over $1,500 in wages in any calendar year or met some other requirements. Under the Act, employers are required to provide job protection, meaning that for individuals who have been employed with them for 180 days or more, employers are also required to withhold premiums from the employees' paychecks. My understanding is that this is already being done, and the premiums are going to be a little bit different depending on the employer size, but generally smaller employers that have less than 10 employees are required to pay 0.45%. Employers with 10 or more employees are going to be required to pay 0.9% of the wages. Only up to 0.45% may be deducted from the actual pay to the employee, meaning for smaller employers, you can deduct the entire 0.45% and pay that to the family division as a premium. For larger employers, you can deduct half, and the employer would be responsible for paying the other half of that premium.
Thank you, Adam. Our next question, I believe, is geared towards Zach here today. I'm just needing some clarity surrounding the unemployment issue. So people are being told that they can't get unemployment because they aren't paying into it, specifically live-in caregivers. How is this being tracked?
So I think it might help to provide a little bit of context first. So unemployment insurance is a federal state partnership program. So the federal government sets at a high level how unemployment insurance functions. That's through the Federal Unemployment Tax Act and the Social Security Act. And then from there, states have wiggle room as to how they administer it, as long as they stay within the federal rules, regulations, and laws related to unemployment insurance. Unemployment insurance at the federal level sets what employers are qualified for unemployment insurance and thereby what employees are qualified for unemployment insurance. Unemployment insurance does not cover every type of job and employee, and that's set at the federal level. It also doesn't cover every single reason for losing your job. So one of the requirements for losing your job to receive unemployment insurance is that you had to have lost your job due to no fault of your own. And that's in addition to your employer has to be one of the employers covered under unemployment insurance. So it's not necessarily tracked that, like we're not specifically tracking the people who are not covered by unemployment insurance. We're tracking the people who are covered. So those employers are paying unemployment insurance premiums into the unemployment insurance trust fund, which is managed at a federal level. If your employer is not a covered employer under unemployment insurance, then you're not paying into that unemployment trust fund and your job or employer doesn't qualify for unemployment insurance. So an example would be gig workers and self-employed workers are not covered under unemployment insurance and cannot be covered under unemployment insurance due to restrictions at the federal level.
Thank you, Zach. The next question is also for you. This is both, I think, two-pronged, both wanting information, both local and federal. So can there be a waiver for CDASS employees or spouses to employers to be able to collect unemployment?
No. So unemployment insurance is only for the employee who lost their job due to no fault of their own in a covered industry covered by unemployment. So there, you can't get waivers for a spouse to receive unemployment insurance if your spouse lost their job due to no fault of their own.
Okay. Thank you, Zach.
And that's a federal requirement. That's not something that Colorado can change.
Thank you for that clarification. This next one is, I can provide a little bit of context. So the FMS is the Financial Management Service Provider. And so they handle a lot of the administrative things for the CDASS program, including taxes and managing that process. So I'm not sure if this would be Adam or Zach, but can you tell us how to advise our employees if the FMS, the Financial Management Service Provider, messes up their taxes? What is the employer's responsibility? Maybe you need to do rock, paper, scissors.
I can speak for unemployment insurance at least. If the employer is an employer covered under unemployment insurance, then they need to speak with our employer services team. And you can find that on our website and they can help with that. Past that, I can't make any statements about any other systems.
And on the family end, so if an employer or if the FMS over withholds premiums, meaning they withhold more, they have a bigger deduction than they're allowed to do. The division is currently working on some reporting mechanisms that the worker can report to the division. Ultimately, it is the employer's responsibility, and if the FMS is taking care of that for them, that would be the FMS's responsibility to make sure those deductions are properly withheld. And you can always go to the employer first and say, hey, I think this was a mistake. But the division will also have the some reporting mechanisms available shortly. And I'm just going to paste the division's website in the comments, and it should be up on that at some point. I don't think it's up yet.
Great, thank you, Adam. And I believe, Adam, you're up on this last one here. We have one more question, and this is from the perspective of an authorized representative who would be the employer for CDASS. As an AR, I wondered what our family program legal requirements are to hold the exact time slot or position open for someone that's gone for 15 weeks and then comes back. So if we filled that time slot with a temp worker for those 15 weeks.
Or so there is a requirement to hold the job position open, or at least a similar job position open for the length of the required leave. Maximum leave time is going to be between 12 and 16 weeks, depending on circumstances. 12 weeks is the standard. You can get up to 16 weeks in the case of a complicated pregnancy. The rules are a little bit, as far as holding the exact position open, the rules only provide that you need to hold a comparable position open. It will be a determination of fact that the division would make whether or not a slightly different shift would count as job restoration. There is a provision that provides that the new job must be similar in terms of shift time, but there is no requirement that it must be identical in terms of shift time. That said, this provision applies only to those who have job protection, and job protection is granted only to those individuals who have been employed for more than 180 days. And that counts as employed from the time of the day they first work. It's not 180 days actually worked. So if they only work 5 days a week, it's still 180 calendar days from the day they're first hired, not 180 like actual work days. So in those instances, the employer would have an obligation to restore that person to their to their same or a similar job once they return from leave.
Great. Thank you, Adam. And thank you to both Adam and Zach for their time and energy that they spent preparing for today and answering our questions, and just appreciate you getting in front of our stakeholders to be able to provide that guidance. So that's appreciated, and I'll speak on behalf of the whole group to say thank you for that. And so we can now take some time. We have just a few minutes before we need to close out this topic. And so, John, we can go ahead and open things up. And please, folks, just do remember that these are general questions, so not specific to any members, no member information. We want to be careful about HIPAA and protecting people's health information. So, John, take it away.
Okay, thanks, Emily, and thanks to the two gentlemen. We have one hand up so far. Anyone else who has a comment or question that you would like to make? I'm looking to see if anyone else raised their hands. If you are on the phone, you can unmute your phone, *6. Give me your name.
John, this is Kathy Estes, please.
Okay, Kathy, I will have you go first and then we'll go to Jessica. Kathy, go ahead. You have 2 minutes. Thanks.
All right. It may be more of a question for Emily. I was just curious, since we already have paid sick leave up to 48 hours for our employees, depending on what they've accumulated each year, will this be in addition to that, or will it be replacing it?
That is a good question. I don't know if it would be directly toward me, but Jessica or Danny on the CDASS side, would you like to address that?
Yeah, I can jump in to address that. Thanks for your question, Kathy. And Adam, if I miss anything, please feel free to jump in as well. So the Healthy Families and Workplaces Act was what spurred the creation of sick leave or sick time, which we've implemented into CDASS. And as you're correct, Kathy, it's up to 48 hours per year. This does not replace family and medical leave insurance. So the two are both benefits for time off for eligible workers. And there's differences in the reasons a person would need sick time over family medical leave and vice versa. So we would really encourage anyone who wants to really understand the differences between those two benefits to first start with your FMS. PALCO and PPL have a lot of great resources that break down this information specific to CDASS really clearly. And then any more complex or in-depth questions can be directed for family to the division, Adam and his team, and then for sick time through the specific department there. I'm blanking on their exact name, but we can definitely get that information out to people. It is contained within the resources that the FMSs have.
Thank you, Jessica.
Thank you.
Okay, thank you, Kathy. Jessica, looked like you had already had your hand up. So is there something else?
Yeah, I just wanted to add a little bit more information as it relates to family and CDASS specifically. So I'm glad to hear people are also thinking about sick time, because it's kind of in that realm in which these benefits that get passed by laws needed to be implemented into our benefit. And sometimes that's easier said than done. So we worked really closely with the division, the family division, and did a lot of preparation and research work even before reaching out to them to understand how this could best be done for CDASS. And so for CDASS at this time, this is an employer paid premium at 0.9%. And the remittances are sent over by the FMS to CDLE on a quarterly basis. And they work together to really make sure that on a fundamental level, everyone's being compliant and the FMSs are assisting in that process. So if anything were to change in terms of this approach, we would definitely let everybody know. It's slightly different than the approach that Adam explained, but it is compliant. We've talked to them about this, and we are ultimately just glad that this is an available benefit to our attendants. We know how hard it can be for people to need time off and not always have it. So having this opportunity, I think, will strengthen CDASS for everybody.
Unmute myself. Thank you. So we have just a few, literally 3 minutes, 2 minutes, 3 minutes. Is there anything else that a stakeholder would like to say by way of comment? If it's a question, we might not be able to have time to answer it, but anything else, you can raise your hand in the webinar to get in the queue, unmute your phone. Okay. Seeing none and hearing none. Emily, I'm going to let you close this out. I think we're done.
That's it, John. So once again, Zach and Adam, let's do a virtual round of applause. So thank you for your participation here today. We really appreciate your time. Thanks for being our special guest here at PDPPC for the month of July. And we'll be in touch if we have more questions. So gentlemen, thank you so much for your time, and have a great rest of your day.
Thanks, you too.
Thank you.
Thank you. So this is John again. I'm going to say we are moving to our break now, 10 minutes behind time, but we're doing pretty well. And there is an error on the agenda for today. The breakout rooms item will be 25 minutes in length and not 35. So it's going to go from, we're going to end now, start the break now, pick it up at 2:35, and then go to 3 o'clock from there. So it all, I guess, works out. All right, folks, we'll see you and hear from you in 10 minutes. Have a good break, and we'll catch you on the other side. Thank you. We'll come back at 2:35. Hello again, everyone. This is John Barry, and we are back for the second part of the Participant Directed Programs Policy Collaborative Meeting, PDPPC. And the next item is number 10, breakout rooms, and I will see if Jessica Corral is with us and can start up this item.
Hi, everyone. So I will open up the breakout rooms now. This will provide people the opportunity to choose the room you'd like to go in. So as a reminder, it's members only, IHSS, FMS, and then the third FMS training and case management. If you don't see a window pop up on your screen, go down to the menu below, click more, and there should be a breakout rooms option. For those of you calling in, hold on for 1 second as people funnel into their desired room, and then you can let us know which room you'd like to go into. We'll need to assign you. Robin Stevens, I know that you intended to go into the members only group, so we can put you in there.
This is Jerry. I don't see any place to make a choice about a breakout room. I would go to the stakeholder one, but nothing's coming up on my screen.
No worries, Sherry. I can put you into that room.
Okay, I see it now.
Renee members.
All right. John, is it okay if I pass this over to you? It looks like
Hey, Jessica, I didn't go either. Where is the breakout room thing? Sorry.
No worries. So if everyone who's logged on through their computer can go to the bottom of their screen, there should be a menu that has an item with 3 dots called More.
Oh, I got it. I found it.
Okay, great.
Thanks. Bye.
So Jessica, yes, this is John. I can take over. I don't know, Renee, if you're in the breakout room yet, but if not, you can let me know what your last 3 digits of your phone number are. Maybe you're already in.
This is Dolores Hurley. I'd like to go to breakout room number 1. My last 3 numbers are 346.
I see a 364, Dolores. Is that it? 364?
Oh, yeah. That's it. Sorry.
No, that's okay. Very good. Anyone else who's not in a breakout room and you want to get into one and need some help? We'd be absolutely glad to do that. Again, if there's anyone else who wants help to get into a breakout room, please let me know. I'll be standing by. Thanks. Hello, everyone, and welcome back. This is John Barry. We are back after the breakout rooms. Looks like we have just about everyone who's going to come back. We are on item number 11 on the agenda, the subcommittee and work group report out. So I will turn this over to the staff. I believe we're starting with the first bulleted item or discussing it at any rate. We do not have the co-chairs with us today, Kurt and Kevin. They did contact us and let us know ahead of time they couldn't attend due to other commitments. And
This is Jerry. I have a hand up whenever you get to that.
yes, I know, Jerry.
Oh,
Thank you.
sorry.
That's okay. So we have covered the second bullet in item number 6. We have covered URUM, I believe. That would be a question for Danny.
URUM is covered, yes.
Okay. I think that we need to, and staff, correct me if I'm off base here, I think we need to postpone the expanding CDASS discussion to when the co-chairs are here. Does that sound right?
That's correct, John.
Yeah. We have already covered the community first choice CDASS work group item. So we have covered URUM. I guess we'll get to IHSS, but let me go to Jerry first. Jerry, you have 2 minutes. Thanks.
My question was, what is the expanding CDASS issue? I've been to, all the prior meetings, and for the life of me, I can't identify what that is. So if you want to just tell me, John, that would be great.
Well, I will defer to my colleagues because they'll do a better job of telling you, but I would ask if someone, Danny or Jessica or Emily, could speak to this.
Hey, John, this is Danny. This isn't something that's being led by the department. So I think I have some notes on exactly what expanding CDASS is, but it's not something we're necessarily taking the lead on. So let me look it up and I'll report back here in just a second, if that's okay, Jerry.
Sure.
Okay, thank you, Jerry. IHSS subcommittee.
All right, thanks, John. This is Emily Harvey. I am the policy advisor for the in-home support services service delivery option, and we just had our IHSS subcommittee by means of the IHSS breakout room. And so we just discussed just some general standing agenda items that we discuss every month, including some complex solution cases that we're looking for support on. CDPHE typically has some updates, but they were pretty quiet this month, so nothing there. And we also discussed a discussion that we had last week with some pediatric agencies regarding supporting ARs. And that discussion went well as well. And really just kind of wrapping it up with an opportunity for some open forum where Consumer Direct, Katie Spade with Consumer Direct announced the information about that really exciting e-learning opportunity. So folks can take that e-learning training to learn more about IHSS. And then they also supplement that with a paper copy, essentially, of that e-learning through a resource guide. And that should be posted to CDCO's website within the next day or so. So that was very exciting news, and I appreciated that announcement. And that wrapped up our subcommittee. And I can kind of stay off mute and continue on with the NCAPS update as well. And so I always have to, so I don't mess it up, I always have to look it up so I make sure I give you the correct acronym. And so NCAPS stands for the National Center on Advancing Person-Centered Practices and Systems. So NCAPS is an opportunity. We do provide quarterly updates for you. So July is one of those months. And so NCAPS, we are a group of folks that are working to expand awareness and accessibility and utilization of the self-directed program. So that's both consumer-directed attendant support services and in-home support services. And through this, it is an 18-month initiative that we started last April. And so we're coming up toward the end of this project. So it ends in September. So we will offer a update again in October when things are wrapped up and we've closed out this project. And some of the things that we're working on now this month include developing a slide deck that offers what Colorado has been working on for the last several months. And that really includes diving into the data, because we have 20 years of experience that we had to really filter through to find where we are now so we can decide where we want to go in the future. And that included digging into some data. It also included some community outreach. So we, unfortunately, that was all kind of handled on my maternity leave. So I can thank my colleague Jessica and the rest of the NCAPS team for taking that on. And that really developed an idea of who knows what, right? So does everybody that needs to know about self-direction know about it? And with that information, we will be developing a toolkit that provides kind of a one-stop shop for all things self-direction so that the folks that need to know that information can get it and that it's readily available and they don't have to go to lots of different places to get that information. So I'm very proud of the work that we've been doing here at NCAPS as we've been working through, and we will get this wrapped up in the next couple months. And I'm excited to share with you the end result at our next opportunity in October. That's it. Jessica, if you want to add anything, please feel free to jump in, but I think that wraps things up for my announcements there. Thanks, John.
Okay, thank you. So I guess I would ask before we move on if there's any questions or comments about the items that were just gone over. Anyone, you can raise your hand in the webinar. If you're on the phone only, you can unmute your phone *6. Danny?
Hey, John. I just wanted to come back to Jerry's question about what expanding CDASS is. And if I'm not mistaken, it was a work group that was created for or by Robin Boldock with the intention of expanding CDASS to more waiver services. So to allow more services to be captured under CDASS. And I believe Robin is chairing that committee and running with that, but unfortunately she's not here today.
Thank you.
Yes. Okay, so we will move forward on the agenda. We did cover the Colorado Department of Labor and Employment CDLE item already. So we are on to the second and final open forum. And again, as I mentioned earlier, so if there's anyone for attendance purposes, anyone who's on the phone only, who has not yet identified yourself out loud, you can unmute and give me your name. I have a whole bunch of names already: Dolores, Ron, Tracy, Renee, Robin Stevens. Anyone else? Okay. So I will take names for the queue for this item, open forum number 2. And again, it's announcements, it's things you want to share with the community here, requests. So please raise your hand in the webinar. We have one already. If you're on the phone, you can unmute *6 to give me your name. Okay. All right, I am going to start on the consumer member family side. Kelly Tobin, please go ahead. You have 2 minutes. Thanks, Kelly.
Hi. It's a question that I forgot to ask during breakout rooms. My aide under PPL couldn't clock in yesterday, and I just wondered if anybody else experienced the same thing.
Folks, you could, since we have 40+ people in the meeting, you can certainly type in the chat if there's a response. that you have? Seeing none so far. Okay,
Hey, John, this is Heather. I didn't know if I missed it. I wanted to put my name in for open forum.
Heather, I have your name down.
Perfect. Thank you.
Okay.
Hi, John, this is Jessica. I see that Alex has his hand up already, but I'm curious if anyone at PPL, maybe him can speak to what was happening with Portal yesterday.
Alex, you're free to go ahead if you like and respond to that, as well as what.
Yes, hi, sorry, I was trying to get myself unmuted and on video. Yeah, so we did have some internal issues with some of our systems to include Portal yesterday. But it was taken as the utmost priority to make sure that our IT departments fixed everything. That I know of this morning, we haven't received any reports of ongoing issues with that. But our systems were having some issues yesterday, so.
Okay, thank you. I see Sandy has raised her hand. I'm wondering if this is some more information.
It is, John. I don't speak too often. But yeah, Kelly, I put in the chat, please reach out to any of us. But we did have problems, a little bit of problems with Edge, which is one of our internets that we use that was causing some of the slowness. So I'm sure the individual your workers should have been able to submit their time. If they couldn't clock in, they could do it manual entry and get in. But feel free to reach out to any of us, Kelly, at any time.
Okay, thank you. We will move on to Danny and then we'll get to Heather. Danny, go ahead. Oh.
Man, when I clicked the mute, it didn't unmute. I just received some information today about the emergency preparedness for power outages. So I just wanted to share some information with this group because we feel that it'd be really helpful. So I'm just going to read you this email I received, and then I'll share the information with you all in chat as well. The Department of Healthcare Policy and Financing has recognized the importance of being prepared for a power outage emergency for individuals utilizing life-sustaining medical devices, with funding made available through the American Rescue Plan Act, or ARPA, and in collaboration with the Center for Inclusive Design and Engineering, also known as CIDE, who will be distributing battery backup power supply systems to eligible Health First Colorado members, assisting them in having the necessary equipment to be better prepared and in maintaining their health, safety, and independence. If you're interested in getting a backup power supply system, please complete the application, which I'm going to put in the chat box. And I think, John, if we can, maybe it'd be good if we could send out an email with this information too, just to all the PDPPC group. But once the application is received, it'll be reviewed, the information will be verified, and a determination will be made if the applicant qualifies. There is a limited supply, and a final decision will be made on eligibility and the availability of devices. All applicants should be notified of their results within 2 months of receipt of the application, and all questions should be directed to Julia Beams at 303-315-1284. Again, her name is Julia Beams, and her phone number is 303-315-1284. You can email her at julia.beams@ucdenver.edu. And you can find more information about this project on the University of Colorado Denver Center for Inclusive Design and Engineering Surviving in Place webpage. And I will put the links and contact information in the chat. Then I think we can follow up with an email as well.
Okay, thank you, Danny. This is John. Yes, I will do that. This item sounds very familiar to me. We have had the announcement about this at least twice in our Office of Community Living newsletters. So those are not specific to CDASS or IHSS, but obviously do include that. We run meeting reminders, announcements, memos. I will send I will find the newsletter, and we have an archive, by the way. I'll send that link, an archive of our newsletters, which is searchable by topic. And I will send the direct link to the newsletter in which we gave the information. So if you don't get those, you can always sign up to get those as well. So let's see. We will go now to Heather Johnson with the department.
Thank you, John. I just wanted to put out a reminder, if you haven't seen it already, we are working on a direct care worker public awareness campaign, and the vendor has a survey and a Jamboard open. So if you haven't already received it and you want to share your input, we'll drop the links in the chat, and you'll also have seen them in John's newsletters. And if you really want a more direct way to talk with the vendor, they will be at Friday's Value and Awareness Action Group meeting from 1 to 2. They're probably going to be on around 1:15, so that would be an option there to be able to connect directly with the vendor about anything you might have. So these links are completely shareable. It'll probably be open through the end of July, probably the first week of August it'll close. So you're welcome to share the link around. Some of it is about messaging, and some of it is really about style and design, and then a piece about like what's the best way to get the word out. So they've got a lot of different options in there to share your input. Thank you.
All right, thank you, Heather. And just a shout out to our online OCL calendar and the ARPA, American Rescue Plan Act calendar, where we list our stakeholder meetings. The meeting that Heather mentioned is on that calendar, and you can go there, copy it onto your own calendar, or use it as a way to click into the meeting. So I will send a link to that stakeholder calendar. And it looks
Thank
like
you very much.
Finally, it looks like we have Alex Contreras. Go ahead, please.
Yes, thanks, John. So I guess just by way of announcement, so PPL right now is going through a carve-out process where we are separating from what used to be our mother company, Public Consulting Group. And so as a part of that, a lot of our systems are changing. So that's going to affect our email address domain. So as you can see, the email address that I put in my contact information had the domain @pplfirst.com instead of the @pcgus.com. So this email switch is going to happen officially on 31 July. The old email addresses or the old domains will still be active until the end of December. But anyone that needs to contact PPL through customer service emails or our enrollment emails that we have, just know that those will change. It's going to be the same initial portion. It's just the domain is just going to be @pplfirst.com. So just wanted to let everybody know that. So if you see changes in email, there's no issues or worries with that. So
Okay, Alex, thank you. Jessica, go ahead, please.
Yeah, thanks, John. I just want to piggyback off of what Alex shared, and thanks, Alex, for updating the group about that. So the unit will be working really closely with Consumer Direct and then internally to make sure everywhere that a PPL email address exists, that gets updated. But it would be good that if you have a contacts list, an address book digitally in your computer and other places that you've saved their email addresses, just make sure you get those updated. We definitely want to avoid people sending out emails, as they would automatically and them not getting to the right place. But as Alex said, it's going to be a transition. So as of now, all of the current addresses are still active. Thanks, John.
Okay, thank you, Jessica. That brings us to the end of the second open forum. Our next meeting is the 4th Wednesday of August at 1:00 p.m. And I will be sending out an email with a bunch of links to our stakeholder calendar. It's a really good one to save in your favorites, or if you bookmark things on your computer. There's an OCL calendar. There's an ARPA, American Rescue Plan Act calendar. And also the newsletter archive. If you're ever looking for something, wondering if we've communicated about it, it's a good place to go. It is a searchable page, which is really handy. So with that, I want to thank everyone for being with us today, and we will see you and or hear from you next month, the fourth Wednesday, August 23rd. Okay, thanks, everybody.